Hello, my name is Faghani. I'm a postdoc research fellow at Artificial Intelligence Lab, Mayo Clinic, Rochester. I want to present an end-to-end deep learning-based model for femoroacetabular impingement syndrome angles calculation. There is no disclosure. Let's talk a little about femoroacetabular impingement syndrome, or FAIS for short. FAIS is one of the leading causes of premature osteoarthritis among young patients. As you know, hip joint is a ball and socket joint. Excessive bone on either femur or hip acetabulum causes pathologic contact between these two bones, which damage the labrum or the cartilaginous layer. FAIS limits joint flexion and internal rotation with a prevalence of 10 to 15% in adults. Here in the first image, you can see the normal hip joint. And in the second image, you can see the hip joint, a hip joint with an excessive bone on hip acetabulum, which causes FAIS. Early diagnosis and treatment have been found to reduce symptoms and improve function. Although FAIS is a clinical diagnosis, a number of established imaging findings, including alpha angles that you can see in figure B, acetabular version angles that you can see on figure A, and femoral neck anteversion angle that you can see in figure C, aid in supporting the diagnosis. While imaging support the diagnosis, angle calculations are time-consuming tasks. An automated tool would be impactful. In this study, we developed an interpretable deep learning-based approach that automatically calculates the aforementioned angles for diagnosis of FAIS syndrome using CT scans. To train our model, we obtained bilateral axial hip, oblique axial hip, and distal axial femur CT scans of patients with FAIS impression. Dataset was split into train, validation, and test set at the patient level, targeting a 70, 20, and 10% splits. We trained a 2D unit on axial CT scans for bone segmentation. Then, with the mass that we got out of the 2D unit, using image processing, we determined the key points and also drew the lines, drew the angles, and calculated the angles using image processing. And then on the oblique axial CT scans, we trained a 3D unit for femur bone segmentation. Then again, we determined the desired slice, key points, drew lines, drew the angle, and calculate the angles. We included 20 patients, calculate the angles, and compared each angle with the musculoskeletal radiologist reported angle. Our model achieved a mean squared error of 5.4 degrees. In conclusion, we developed an end-to-end deep learning-based model for angle calculation in FAIS using multi-view CT scans. The development of these automated tools could reduce the radiologist workload in reading CT scans and facilitate early diagnosis and appropriate treatment. Of course, validation with more data and external validations are necessary steps before clinical adaptation. Thank you for your attention.